Herniated discs are a very common disorder that we're finding in the clinic. It can vary in terms of the intensity, and it can vary in terms of where the symptoms are located. But I think the first part of this is to try to understand what the disc is or where it is. As you can see on the model, the discs are sitting right along your spine from the top to the bottom, and as you can see, they're running in between your vertebrae, sort of right through here. Here's a clear one, and the clear one, and the clear one, and obviously down here in the lumbar spine, they're a little bit thicker. But the disc is a two-part structure. It has a nucleus on the center, and it has what's called your annulus, which are your rings or cartilaginous rings holding the nucleus in. Think of a water balloon or think of a jelly donut. That's what usually we refer to when we're trying to explain what it is. And like a water balloon or a jelly donut, if you squeeze on one end of that water balloon or jelly too much, or donut too much, it squirts or protrudes out the other side. If I squeeze over here, it's going to bulge or protrude out this way. So when we talk about a herniated disc, the first step is this sort of protrusion or bulging of the nucleus sort of out towards the annulus and pressing up against the annulus, sort of distorting the shape of the annulus, causing some mechanical pain. If it continues to go on and this pressure continues to build, eventually the annulus will tear or rip, and the nucleus can then now seep out of its space, and that is what we call a herniated disc. It's an advanced version of a protruded or bulging disc, and the symptoms can vary quite a bit. It can range from back pain in the middle or on one side or the other, or it can refer or radiate down into the buttock or down into the leg or lower leg and even into the foot. There can be pain and also numbness and tingling, pins and needles, and in terrible conditions, you can have some weakness. Now, weakness can only occur if there's a tremendous amount of pressure on the nerve root or a sustained pressure on that nerve root for entirely too long, creating the weakness. But the symptoms will begin to travel or peripheralize. They can get more intense in nature. And the steps in order to recover from a herniated disc can be tricky. My advice is always to seek out a clinician who's dealt with these kinds of problems. But even before then, if it's time constraints or it hurts too much, the best solution is probably to lie down on your stomach, maybe put a pillow underneath your pelvis to support it, and eventually take that pillow away and try to lie flat on your stomach. That's going to enable the nucleus to start its progression or start its migration back into its space, back to where it belongs. The symptoms can start to get a little bit better with that, but more importantly, mechanically, I think the disc will be helped. And then eventually you're going to move on to see a clinician and they can help you further. But it's a very complicated problem, and the symptoms can range quite a bit. So it usually requires, at that point, a skilled clinician to help you out.